Thank you very much. This, of course, is a very personal and emotional occasion. It reminded me of what happened in Sunday school. School teacher said to the class, "Who made you?" And the little boy said, "God made part of me." Teacher said, "Part of you?" He said, "Yes. God made me, I was small, but I grew the rest myself." Like that cheeky little boy, I was small when I came into the world. But unlike him, I am not so brave, so cocksure to say that I did it all by myself. Tonight, I will really be acknowledging the contributions that so many people have made to grow me, to strengthen me, and to put me to where you see me this evening. I followed the example, or perhaps the advice, of George Bernard Shaw. He said, to be successful in life, you must choose your parents with care. I chose the best. My mother, who taught me to read, write, and play the piano. My father, who was a school teacher, a pastor, and a distinguished musician. They taught me, and they surrounded me with siblings, extended family people, and others who together conspired to educate me, to inspire me, to support me, and to strengthen me. That is the success which we are noting today, not like the little boy who did it all by himself. And I'm very happy to accept this honor on behalf of all of those who have done so much for me, and I hope that they will feel satisfied that their efforts have not been in vain. You'll permit me to say a few words about how I got involved with infectious diseases. My choice of specialty was very strongly influenced by my own personal medical history. My first birthday party had to be canceled. I had an attack of measles complicated by pneumonia. This was November 1932, 3 years before sulfonamides were discovered, 8 years before penicillin was available. And so the outlook seemed very grave. But as you can see, I survived. Only sanction is that my parents decided it was too risky to hold birthday parties for me, and they have been none since then. Throughout the rest of my childhood, I suffered a whole catalog of infectious diseases, including repeated attacks of malaria, sometimes with life-threatening complications. So by the time I left Nigeria at age 17 to go and study medicine in Britain, infectious diseases and myself had become sworn enemies. The 11 years I spent in England could be looked upon as getting ready for battle. And when I came home, I realized that this was in fact a great battle. The stark contrast between the clinical picture in Nigeria compared with that in England where I had studied was shocking. I'll give you an example. At that time in England, the whole year they would see 20 cases of tetanus. At the teaching hospital where I worked, that teaching hospital alone, we saw 200 cases in the adult medical ward each year, not to count the large number of children with tetanus neonatorum, and so forth and so on. So we went into battle, clinical management of cases, advice and prevention, and so on, but also, very importantly, research. We were very pleased that the work we did on anti-malarial drugs contributed to the registration of Fancida and Maloprim. We were also very happy that when we tackled the problem of schistosomiasis in children in that part of the world, we found that many of them had hydronephrosis, even as early as age 6. A team of experts from London School of Hygiene and Tropical Medicine have found the same in East Africa. And they recommended that these children should be subjected to direct surgical treatment. We tested the effect of chemotherapy, and we were very pleased to be able to report that chemotherapy alone led to relief of the obstruction in most of the cases. And so came the strengthening of the global policy for the treatment and management of schistosomiasis, which is based on mass drug administration. The next stage of the battle was, as mentioned, when I spent 10 years in WHO dealing with these diseases. One of the most pleasing results I think we got was the development of multiple drug treatment for leprosy. And by 1985, 9 years after we started this work, WHO adopted the use of multiple drug treatment as the standard method for controlling this disease. At that time, 122 countries had significant amounts of leprosy. Today, there are only 3 countries with such high prevalence. And we are now looking very carefully at the possibility that leprosy will, in reasonable time, be eliminated as a public health problem throughout the world. We also worked with Merck Company Incorporated on ivermectin in treating onchocerciasis. And when we saw the clinical results, which were very good, I visited their office and entertained by the CEO, Dr. Roy Vagelos. I was nervous. The drug was good, but the price was, in fact, not affordable. It was used for cats and dogs at $10 to $15 per dose. And as I explained my worry to Dr. Vagelos, he surprised me by saying they decided to donate the drug for the treatment of onchocerciasis. How much, I asked? Oh, as much as is required. For how long? For as long as it is required. So I was there at the birth of a new form, a new model of pharmacophilanthropy, in which a drug company would look at a disease and say, we're going to fight it out, and we're going to win. Other companies have followed that example. Pfizer has taken on trachoma. GlaxoSmithKline has taken on lymphatic filariasis. And a consortium of drug companies have taken on leprosy. And so we are now, we've now recruited a new band of soldiers to fight against these diseases. I feel very, very happy that we are on the winning path. But we must not be complacent.